Patients often ask, can cataracts come back? And the answer is no. What can happen is that the membrane which is used to support the lens implant in the eye can become slightly fuzzy. And this is because the eye is trying to heal following cataract surgery. So during surgery we take extra care trying to reduce the inflammation, trying to reduce the occurrence of scar tissue forming. And this is either with surgical technique or the design of the lens implants. However hard you try, the eye still tries to heal. And therefore we reckon there's an incidence of probably 20% in 5 years where the posterior capsule, as it's called, the membrane supporting the lens, goes cloudy. The symptoms of cataract appear to come back, and it's something which is extremely easily treated with laser. It's a procedure which takes probably 5 minutes, and effectively you're making a hole in that membrane to allow the vision to clear again. So it would appear that from the patient's symptoms that the cataract can come back, but this is due to the membrane which is becoming cloudy and is extremely effectively treated with laser.